Speaker is Mrs. Sampada Shevde, Director Parkins India. She is going to talk on establishing inclusive eye services, our experience.
As an extension to all the eminent speakers talking about inclusive health services, my presentation will focus on children with multiple disabilities and vision impairment. So, before we begin, just to share a background or to set the stage, who are these children with multiple disabilities and vision impairment that we are talking about, or we are going to be hearing about in this presentation? The first photograph on the slide is of a child who is totally blind, and he also has a hearing impairment, what we also commonly refer to as deaf blindness. The second child on the slide in the yellow t shirt has low vision, and he also has a physical impairment or cerebral palsy. And he's trying to grab the yellow toy that his father is trying to show him. The third photograph is of a child who has again cerebral palsy, vision impairment, and an intellectual disability. And she's with her mother trying to explore a tactile and light based toy. And the last photograph on the slide, where you see the student with her teacher, is again of a student who has low vision, cerebral palsy, and an intellectual disability. So, when we are talking about children with multiple disabilities and vision impairment, these are all the children that we will be referring to. Okay. Meet Rihan. In order to identify all these children with multiple disabilities and vision impairment in the community, our team in different states, currently we are in the state of Uttar Pradesh, do a lot of screening activities in the community. All these screenings would be through door to door, screening in regular schools, screening through village camps, with the collaboration of civil hospitals. And through all these screenings, we have identified several children like Rihan. So, when we first visited Rihan at his house, the first complaint or concern that his family had was that Rihan doesn't use his vision at all to do anything. All he did was use his sense of touch. Because Rihan also has a profound hearing impairment along with his vision impairment. In collaboration with eye hospitals like the Sitapur Eye Hospital or Dr. Shroff's Charity Eye Hospital, Rihan fortunately received a proper clinical assessment. He received a pair of spectacles, and after that, today Rihan does a lot of activities where he uses his vision very effectively. Right from pre reading, writing, coloring to participating in games. And it has made a world of difference for children like Rihan. And special mention to hospitals like Sitapur Eye Hospital or Dr. Shroff Charity Eye Hospital, even LV Prasad's Eye Institute, with whom we have collaborated earlier. Because assessing these children can take multiple times for assessment. It's not a simple process, but the patience which the vision technicians and ophthalmologists have had have made it a lot easier for several children like Rihan. In addition to the clinical assessment part, our team of special educators also does a thorough functional vision assessment of the children to ensure that when we plan an educational program for them, all the children have the adaptations that they require to use their vision very effectively beyond having a spectacle or a low vision device. We realized that just doing the clinical vision assessment part and providing a child a pair of spectacles or a low vision device and letting parents know how he should use his spectacles is not enough. Because when we are talking about children with multiple disabilities and vision impairment, they require a lot of intensive intervention. And for this reason, we have set up intervention centers at both the hospitals, at Dr. Shroff's hospital at Vrindavan and at the Sitapur Eye Hospital. And our dedicated team of educators, vision therapists, physiotherapists ensure that all these children don't just stop at the clinical vision assessment, but go on to receive comprehensive educational rehabilitation. Several children with vision impairment and cerebral palsy who require therapeutic intervention, we ensure that they do have the access to that at the center. Several children require assistive devices. It could be a wheelchair, it could be a chair for cerebral palsy, it could be a walker, anything and everything that the child requires to use his vision and, most importantly, to learn. They learn several new skills at the center apart from learning to use their vision. It could be skills in the area of cognition, socialization skills, using their hands or motor skills. It's a range of skills that they learn along with each other, supported by the educators and parents. Dr. Namrata, Dr. Praveen mentioned a lot of barriers for children to having access to services, whether educational or health services. A big factor is affordability and physical access to the center, specifically for children who belong to the below poverty line economic group. For them, to ensure that no child who needs intervention is left behind. If a child can't access the intervention center at the hospital, we use the community-based approach to ensure that the child receives intervention at home. The most crucial component in this entire process of intervention is the parents. And parents receive regular training. If you look at this photograph of children sitting at the intervention center at the hospital, you see a group of children with special educators as well as their parents. So all along, it's about transferring skills to the parents as well. Because at the end of the day, we are also thinking about how to make this model sustainable so that it lasts forever and children continue on their journey of learning. It doesn't stop with us. So at every step, whether it is intervention at the center, at home, in the community, parents are always along with the special educators, learning all those skills and following up on all that they learn in the home setup as well. Till date, we have been able to screen more than 3,500 children. All of these who require the vision intervention, we ensure that they have received the vision intervention, surgery, spectacles, and beyond that, more than 300 children with multiple disabilities and vision impairment are receiving intensive educational intervention. Of course, considering the magnitude of the problem, this is just a beginning, and we have a long way to go. So, thank you.